With warmer days now here and more time spent in the sun, today we're talking about staying safe from harmful sun rays. Joining us now is Dr. Vincent Reid, surgical oncologist at the Hall-Perrine Cancer Center, with some advice on skin cancer prevention. Thanks for joining us here today, Dr. Reid.
Thank you.
And tell us, how common is skin cancer?
Well, it's estimated that about 1 in 5 individuals in the United States will get skin cancer before the age of 70. So it's pretty common.
Yeah, absolutely. Who is most at risk for skin cancer?
I think everyone is at risk, obviously, but melanin-rich individuals are less likely to get skin cancer. Certainly, individuals are not as melanin-rich more likely, but everyone has some risk.
There's always a little risk there, yeah. So what SPF do you recommend for sunscreen, and do different brands really make a difference?
I'm not sure different brands make a difference. I think with regard to the SPF, most dermatologists or most people who take care of skin cancer will tell you that a SPF of greater than 30 is what's recommended. And while you may get small incremental benefits above 30, nothing is 100%.
Right. So what else can you do to avoid damaging your skin when you're outside?
I think protective clothing is one. I mean, certainly hats for our golfers, etc. Protective clothing is very important. And then I think reapplying sunscreen. I think, what ends up happening is that most individuals remember to use sunscreen at the beginning of the day, but their reapplication is a problem.
So how often should you reapply it, and how much should you use when you
I think within the hour you should probably reapply and cover the exposed areas.
Mm-hmm. And so what about moles? What should you watch out for?
I think you should watch for changes. Any changes, I mean, most people are familiar with what moles they have. And they're very familiar when something, if it grows, if it becomes asymmetrical or irregular, certainly if it bleeds. And these are some of the big concerns. Any significant change to a mole is something that you should bring to the attention of your doctor.
Yeah, and when you do spot that, what's the next step?
The next step is to bring it to the attention of your physician, where you will likely undergo a biopsy to make sure that it's not something that needs to be removed.
And what does that process look like if it does need to be removed?
So usually most people do a quick biopsy, like a punch biopsy, and then if it needs to be removed, you either see a dermatologist, where you can, it can be removed in layers, something called Mohs surgery, or you'll see a surgeon where it's excised and the area reconstructed.
And as you know, with cancer a lot, prevention's the key, and moving quickly as well. Is that the same for skin cancer? Is that time can really be on your side?
It is. Like with other kinds of cancer, earlier detection leads to a better survival. Obviously, there are different kinds of skin cancer, but in general, earlier detection is very, very important.
And is it important, especially for kids, to be protected by sunscreen in way of the sun, or just everyone in general?
Everyone in general, including kids, sun damage and sun exposure tends to be cumulative. Right. So, your risk at 50 is definitely different than your risk at 70, and that's why, it is estimated that 1 in 5 people will get skin cancer by the age of 70.
And so any final advice you have about skin cancer prevention?
I think, pay attention to your skin, pay attention to even pre-existing moles, things that have been there for a while that you think it's just always been there. If it changes, it raises concern, and you should bring that to the attention of your provider and use sunscreen and protective clothing.
Good idea. All right, Dr. Vincent Reid, thanks for joining us here today.
Thank you so much.
And stay with TV9. We'll be right back.